Hi, I'm Dr. Kit Weathers, and I'd like to welcome you to the Las Vegas Institute for Exceptional Dentistry. Let's go into the clinic, and I want to show you something very exciting. Hi, I'm Dr. Kit Weathers, and I'm the Director of Endodontics for the Las Vegas Institute. I've been a clinician for over 35 years, and I've been teaching general practitioners all over the world how to perform stress-free and profitable endodontics. Now, over the years, I've seen a lot of changes in endo and the techniques that are being used. One product that I have been both using and teaching in my endodontic courses for many years is Medidenta's Sonic MM1500 handpiece. This is a product that I feel is essential for maximum efficiency as well as for clinical success when doing endo. I first like to utilize the cutting efficiency of the Medidenta Sonic MM1500 to quickly open up and flare the coronal portion of the canal before I instrument the apical portion with rotary nickel titanium files. I then use the Sonic MM1500 for the irrigation efficiency the handpiece provides by way of acoustic streaming, which helps rid the canal of debris and bacteria.
Hi, I'm Dr. Lou Graham. I'm a general practitioner from Chicago, Illinois. I've been practicing for 25 years. In recent years, we've had revolutionary changes in endodontics and the way we are doing endo in our practices. There's no question that a lot of the new endodontic techniques have made our lives so much easier. One product that I have in my office that I use on each and every case is Medidenta's MM1500. This is a product which can be implemented with any of the many great endo systems on the market today, or even when you're using hand filing. The first beauty of this is that you don't need to purchase any additional equipment. It simply screws right into your normal delivery system.
Hi, I'm Dr. David Maddow.
And I'm Dr. Rich Maddow.
As dentists and seminar leaders for dental groups all over the world, not only do we get to speak with thousands of dentists and team members each year, we also attend as many dental courses as we possibly can. So when something comes along that we know can help every single dental office in the country, it's pretty exciting.
A recent study has shown that by increasing the amount of endodontic cases you perform in your office, on average, your production will go up 15% in just 1 year. And remember, endo is one of the most necessary and one of the lowest overhead procedures we do in dentistry. But what's really important in endo? Completing the case properly so there's little to no post-op pain and beautiful healing for excellent long-term results. That way our patients are happy and they get to keep their teeth.
We all know that the key to accomplishing an excellent result in endo is proper disinfection and cleansing of the canals. There's probably nothing more important in endodontics to guarantee the success of a case than that. But with so many different methods being taught, it just gets confusing as to which are the best techniques and instruments that we should be using for the best results.
That's why we love the Sonic MM1500 handpiece by Medidenta. This is an instrument that not only works with whatever technique you're currently using, but will improve your results like crazy. You'll be able to complete your cases more efficiently and accurately, which translates to happier patients and a more productive office.
Start by making the initial access. Begin with the number 10 hand file as you normally would. Instrument the file down as far as you can without meeting resistance. When you do begin to meet resistance, this is generally where the curve of the canal begins. At the point of resistance, we can now mark our hand file with the rubber stopper, and this will become our temporary sonic working length. It's now time to insert the Respisonic or Shapersonic file into your Medidenta MM1500 sonic handpiece. The Respisonic or Shapersonic file can be used interchangeably, keeping in mind that the Respisonic is the more aggressive cutting instrument of the two. The file can be inserted from the front or back by pulling the spring-loaded cone downward toward the base of the handpiece. Once the file has been set to its desired length, you can release the spring-loaded cone and the file is now locked into position. The Medidenta MM1500 sonic handpiece has a built-in depth locking gauge, which eliminates the need for rubber stoppers, so your sonic working length should be measured from the depth gauge to the tip of the file. Now that the file is set to its proper working length, the sonic handpiece should be set so that there is a 1 to 2 millimeter pendulum swing at the tip of the file. This can be achieved by pressing the foot pedal while turning the tuning ring at the base of the handpiece. Now the handpiece is ready to be utilized in the canal. Make sure that you insert the file passively into the canal in the off position and take it down to your sonic working length prior to pushing the pedal and filing to avoid any type of ledging possibilities. You should begin with a number 15 Risposonic or Shapersonic file. Once you insert the file to your sonic working length, you should be utilizing a simple up and down circumferential motion for about 30 seconds per file. Repeat this step with a number 20 and then a number 25. You want to use a continuous circumferential up and down motion to ensure the shaping and cleansing of all areas of the canal. Also notice the continuous irrigation coming directly from the handpiece, which ensures that all debris in the canal is flushed out and that the lateral canals and tubules are being cleansed. Refinement of the apical 1/3 can now be accomplished by negotiating the curves of the canal using your current technique, whether it's hand, gyro, or a rotary nickel titanium filing system. After you've completed the filing of the apical 1/3, it's time to do a final disinfection. Now, using a syringe, you can inject your sodium hypochlorite or whatever irrigation method you're currently using and introduce the sonic to better disinfect the canals. This can be accomplished by inserting a sonic irrigation file into your Metadenta MM1500 sonic handpiece. These are non-cutting files and are used for the agitation of the sodium hypochlorite or whatever irrigant you're using and may be taken down to your full working length if you desire. Before starting the final disinfection, make sure you turn off the water on your delivery system so it doesn't come out of the spout at the tip of the handpiece. This process can be done for about 1 to 2 minutes. The cavitation action of the sodium hypochlorite allows the solution to discover, open, and debride lateral canals, which otherwise would not be achieved without the acoustic streaming of the sonic. The high-speed bubbling action also safely removes pulp material and bacteria and significantly reduces sterilization time. Implementing this irrigation technique will give you textbook results in less time every time. Now you can fill the canal with Metadenta's tetracycline gutta percha or whatever obturation technique you are currently using.
From a clinical standpoint, we know that most endodontic failure is caused from bacteria within the canal. The irrigation benefits of this handpiece will greatly reduce the chance of post-operative problems due to the sonic cleansing of all the lateral canals and tubules that would otherwise be very difficult to cleanse with just a syringe and irrigant alone. It's all about peace of mind. Endodontics, first and foremost, is all about cleansability and removing bacteria. The Metadenta MM1500 does this, and it's simply a wonderful addition to accomplish this process and allow you to complete your root canal therapy.
Now these days, many clinicians recommend soaking the canal with sodium hypochlorite for 30 to 45 minutes. Now, a recent study in the Journal of Endodontics said that if you will activate that solution of sodium hypochlorite with a sonic file for 2 minutes, you get the same result as if you just soak the canal for 32 minutes with sodium hypochlorite. So if you'd like to increase your clinical success when doing endodontics and have less post-op problems, I recommend adding the MM1500 handpiece to your present armamentarium. You'll be glad you did.
Some dentists are actually trying to do endodontics using their ultrasonic scalers. It just really doesn't make a lot of sense.
No, that's really not what that instrument's used for.
No, it's really not. Actually, the ultrasonic scalers, they operate at over 20,000 cycles per second. And at that intensity, it's very difficult to control. You're more prone to perfing the tooth and creating ledges. It really just doesn't work.
Yeah, and you know, there's no question you need to use the right instrument for the right procedure, and that's why we really like the Metadenta Sonic MM1500. It's designed specifically for endo, so the maximum vibration is low. It's only 1,500 cycles per second. The low vibration allows the file to function at a level which you can really easily control and do your root canal safely. This instrument can be used no matter what endo system or technique you're using right now. You can use the MM1500 and improve every single endo case from the first day. There's really just no reason not to try this fantastic instrument, and your first case alone will pay for it. You'll start getting better results and happier patients. So go ahead and give it a try. Endo's a fantastic practice builder, and we love the Metadenta Sonic handpiece. It should be used on every single case. You should do it too.
It makes a lot of sense. You definitely should do it.